Thank you. Next, I'll call upon Dr. Brinda to present a paper on E-log Atlas, a timeless reflection of postgraduate life.
Good afternoon, everyone. I'm going to present on E-log Atlas, a timeless reflection of PG life. A logbook is an integral part of PG residency because it helps in a structured learning and it helps a PG resident to document our clinical as well as surgical milestone. It encourages our responsibility and it helps us how much we have to improve where we are lacking. It improves professionalism and a logbook can be used for evidence of certification and portfolio for future exams. For a mentor, it can be used to assess how much their mentee is improving and where they have to train them, and it ensures competency. For years, we have been following a written logbook, but with a written logbook, there is legibility issues and it is prone for human errors. There is risk of loss because there is no option for a backup, and storage is also limited with a written logbook. To find a case in a written logbook is difficult as there is no option for search. So inconvenient to update because when we update it become more messy. There is limitation of maintaining high quality images. It is difficult to share. We have to present physically to share it. And there is lack of integration. Ophthalmology heavily relies on visual diagnostic, and for an ophthalmic resident, it is really crucial to interpret and remember the images we are seeing in order to develop a strong diagnostic skill and clinical decision making. So that is how we attempted to revamp the traditional logbook approach by encompassing more clinical photograph along with a concise summary of interesting cases we see in OPD as well as community outreach program. We collected images from the same in 10 months of our first year residency. Initially, we used to collect images using our smartphone. We even tried to collect series of images of the patient during their follow-up visit also. Later, once we were okay with the slit lamp, we tried to collect images we have taken with the slit lamp, which is attached with an imaging system. So with the slit lamp which were not attached with an imaging system or especially in the peripheral center, we use small smartphone adapters to attach with the slit lamp and take the images. In fundus photograph, we collected from the fundus imaging system in our hospital, and for community outreach program, we used 3D printed anterior segment photo imaging system to take the anterior segment photographs, and for posterior segment we used smartphone based 3D printed 3D printed posterior segment imaging system as well as smartphone based portable fundus cameras to collect the posterior segment images. Later, we used to discuss with our consultant regarding the images and we used to collect the short summary of the cases and we documented it into simple digital platforms like MS PowerPoint. Later, we added annotation to the images to improve the quality of the images so that it will be more helpful for us in future. I would like to request you to look into few pages of our E-log Atlas we have created. On process, we used to collect images even from the operation theater and we cooperated with the lab we are attached with, and we used to collect the pathological images also and add annotation to the pathological images also. Later on, when the images were increasing, we divided it into specialty wise, into anterior segment as well as the posterior segment. So changing from a written logbook to e-logbook has improved efficient data entry because the fields were customizable and there was an option for automatic backup and it can be secured with password also. There is an option for search, so it was easier to find for a case and it was more flexible and easy to update. It was easier for sharing and remote access were also possible. And multimedia integration were also possible. It improved our accuracy of logbook and standardized the documentation. This is the e-logbook we follow now. And adding images to our logbook, that is creating an e-log atlas, has enhanced our visual learning. It encouraged our active learning and reflection. Always image stays in our brain better than a text. So it improved our retention and recall. It enhanced the learning of disease management, and it supported our collaborative learning because we used to share the images as well as summary and details in the WhatsApp group so that everyone will be benefited from that. And it aided us as a potential tool in the OSKs and Vivas, and it helped to integrate technology in medical education. That is, we can either add hyperlink of the video, surgical videos also with the logbook, and it can be protected also with password. And it facilitated the mentor for objective assessment and virtual feedback. To conclude, eLog Atlas stands as a cherished, timeless reflection of our postgraduate life by beautifully merging the precision of a logbook with the richness of Atlas. So we can adapt this eLog Atlas in our PG resident curriculum also. This is my references. Thank you.
Thank you. Any questions? Ma'am? Thank you. And
Thanks.